Hey there, folks. This is Mr. Young, and I'm going to take you through this worksheet that is called, or notes sheet maybe. It's called Factors That Change the Effect of Poisons. This also applies to drugs and toxins, which are essentially the same thing as poisons. Okay, first up, stomach contents. Basically, if you have an empty stomach, there will be more or faster absorption of a toxin or a drug. And if you have a full stomach, there will be less absorption or it will be slower absorption, okay, because your stomach is busy dealing with the food that's in it, putting those nutrients into the bloodstream, and they block the access of the toxin. They dilute the toxin. Okay, so stomach contents can definitely have an effect. Up next, number two, the body size or weight, age, and gender. Now, generally speaking, if you are bigger, if you have more body mass, then drugs and poisons will have a slower effect or they will have less effect overall. Male versus female. This can be different for different drugs. Generally speaking, females are more strongly affected by alcohol. That is not necessarily because they are smaller, but it is because of different metabolism and different body chemistry. Whereas there are some drugs that actually affect females less than males, and that mainly has to do with the body fat to muscle ratio. Females tend to have a little more higher ratio of fat in their tissues than males do. So different drugs will affect you differently if you are male versus female. And finally, generally speaking, if you are very, very old or very, very young, then you will be more strongly affected by a drug or by a poison. Okay, exposure time. This can vary depending on the drug or toxin. Generally speaking, longer exposure to a drug or a poison will have a stronger effect, a worse effect if it is a poison, but there are some weird exceptions to this, like you can build up a tolerance to arsenic if you are exposed to it very gradually over a long time. So in general, exposure time can change the effect, but it can be different for different drugs and poisons. Okay, number four, how it's taken into the body. Drugs and toxins can be inhaled into the respiratory system, or they can be ingested or swallowed into the digestive system, or sometimes they can be absorbed through the skin. Now, basically, there will be different effects on different drugs and toxins depending on whether they're inhaled, ingested, or swallowed, or absorbed through the skin. There are so many millions and millions of different drugs and toxins and poisons out there, and they all have different degrees to which they affect you, and it can be different depending on if they're inhaled, ingested, or swallowed, or absorbed through the skin. So very, very different for whatever compound you're talking about. Next up, antagonism versus synergism. Antagonism means that if you take in two drugs or maybe two toxins at the same time, or a drug and a toxin, just two different compounds, those substances, they kind of fight with each other. They reduce each other's effect. That is called antagonism, okay? Because the two substances are fighting against each other. Whereas synergism means if you take in two different drugs or two different compounds, they will actually multiply each other's effect and affect you much more strongly. That is synergism. Okay, so two different compounds can have different paired effects, whether it's antagonism or synergism. And finally, the form of the substance. What do we mean by that? Well, different substances, different drugs and different poisons can have different effects if they are in an element form versus a compound form. Like the element arsenic is not too terribly, terribly poisonous, although it is somewhat poisonous. But arsenic trioxide, As2O3, is very, 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 very poisonous when it is in that compound arsenic trioxide, as compared to just plain the metal arsenic. And finally, if the compound or drug or toxin or poison or whatever is a solid versus a vapor versus a liquid. Some things are more, have a stronger effect in the liquid form, some have a stronger effect in the solid form, some have a stronger effect in the vapor form, but the phase, solid, liquid, or gas of the substance can definitely affect how strongly that substance affects your body. Okay, and I think that brings us to the end. Thanks for tuning in.